would you compare human dentistry to pet dentistry?
Both pet and human dentistry are both equally as important. Both are very important for just overall health and maintaining the health of your teeth as well as just your overall well-being. Anatomy is very similar between the two, and a lot of the cleaning techniques that are used on the human side is what we use when we clean a dog's teeth. We use an ultrasonic scaler to get the tartar out off of the tooth, away from the gum, under the gum. We also polish the teeth once we're done. We have digital x-rays that we take x-rays of all of the teeth to maintain that the roots are all very healthy. And other than that, it's very similar. For the obvious reasons, it makes their breath smell better, but for a medical side, the bacteria that causes dental disease can lead to a lot of other problems as well. It can lead to abscesses, it can lead to weakened teeth that may break a little easier, but the bacteria can also get in the bloodstream and spread around, causing other issues, whether with the heart, the liver, the kidneys. It's a source of infection that can spread. So what we're looking for, obviously, are things on the tooth, but the x-ray allows us to see the roots to make sure that there's no pockets or no infection or no broken roots or no other signs of any kind of a disease process that could be going on underneath the surface. So what we're doing now is we're probing for pockets, because what can happen is as you get dental disease, bacteria can work its way under the gum and it can start to erode away the bone, the gum tissue, and it can create a pocket. And so we can measure the depth of the pocket of each tooth and then record that depth to know if there's severe dental disease. So a dental procedure in dogs does require, and cats, does require anesthesia. And so when they recover from the procedure, it's very similar to when they're coming out of anesthesia after a spay or a neuter or other type of procedure. So there are some things that we go over, discharge instructions when we send you home with your pet. And it's things about just they're going to be a little lethargic, maybe a little groggy for a few hours. We always wait for a few hours before we feed them, just so they don't have any issues with vomiting or things like that. But generally, by the time they go home, they are ambulatory. They're able to get in the car, they're able to get out of the car. Very seldom are they unable to do those types of things. But they go home and usually like to kind of lay low, take it easy, and just have a low-key